Hello everyone, my name is Pooja and I have done my master's in microbiology. And from the past 1.5 years, I've been associated with MyAussieTutor and assignment services and provided online services. So today we'll be discussing a very interesting topic, which is peripheral vascular disease, also known as PVD. So these are the learning outcomes of this presentation. We'll be able to understand what are the triggers or risk factors for peripheral vascular disease and what are the causes of PVD and how diagnosis and prevention can help to manage PVD at an early stage. Moving further, we'll discuss a bit about the PVD in brief. So PVD, which is also a short form of peripheral vascular disease, is actually a blood circulation disorder that causes the blood vessels outside of your heart and brain to narrow, block, or spasm. And this diagram will help you to better understand about how the vascular, or we can say the arteries, gets blockage due, and there will be a formation of plaque will further convert it into a blood clot and will not allow the blood to circulate in a better way, and there will be blockage of a vascular system or the blood circulation, which can lead to various complications, which we'll be discussing in further slides. So it basically develops only in the arteries. So this blockage we are talking about, this occurs in the arteries, which has a property to carry oxygen-rich blood away from the heart to different organs, and that oxygen is used for various metabolic activities, and in this way the mechanism of the body works. But this plaque deposition will lead to the blockage of the airways in the pulmonary system, and in case this blockage is in the pulmonary system, it will lead to breathing complications, and in case this blockage occurs in the cardiovascular area or the arteries that are supplying blood towards the heart, it will lead to various cardiovascular issues. So this is overall about PVD. Moving further, there are some facts which we will discuss in this slide about PVD. Or in case this blockage is including in the arteries, so this is known as peripheral artery disease, and this PAD affects over 8 million people in the US, and people who are above the age of 50 are at higher risk of PVD. Up to 50% of the people with PAD are asymptomatic in the beginning, which means there will be no signs and symptoms of PAD, and further at very rapid rate the person will begin to notice the signs and symptoms, and then the complications can initiate. People who are also experiencing diabetes, either the type 1 or the type 2, are also more likely to develop PAD. So these were the few facts about PAD. Moving further, these are the risk factors. A person who has a history of smoking or diabetes or advanced age, as well as high blood pressure or excess weight or any genetic contribution, or the family is having any history of PAD, high cholesterol, these all are the risk factors that will contribute to peripheral vascular disease, or to be precise, peripheral artery disease. Moving further, these are the areas of pain that occurs, or we can consider these as the signs of PAD. So in case of legs, there will be reduced hair growth, cramps when lying on the bed, and when both the legs and the arms can turn reddish, blue or pale due to the blockage of the arteries, which can turn the skin blue or pale. Legs and the feet, thin or pale skin, weak pulses, wounds or ulcers. And in toes, the blue coloration is a very common sign of PVD. It also accompanied by severe burning, thick or opaque toe. And in muscles, they usually feel numb or heavy because there won't be enough oxygen supply, and it can lead to various metabolic disorders. So these were the areas of pain. So we'll discuss what are the stages, or we can say the phases, that leads to PVD. So this diagram will help us to study what are the different stages of PVD. Firstly, we can see a normal artery, and because of any of the risk factors that we just discussed in the previous slide, it can be high cholesterol. They will be plaque deposition in a very thin line and forms a very thin line around the artery. And further, what will happen if the person will not limit his cholesterol or smoking? The plaque deposition will increase in size, and this can create huge damage to the artery. And further, this plaque will develop and will turn into a blood clot that will limit the flow of the blood to various organs. And due to the insufficiency of oxygen, various metabolic disorders can be hampered, and enough energy will not be produced for everyday work functioning. So this is how the PVD occurs, and how plaque deposition will convert into a blood clot, which will stop, or which will to be more clear, which will limit the flow of blood to various organs. Moving further, we'll discuss what is the diagnosis of PVD and how the healthcare professional can ensure that the person is exactly having an PVD. Firstly, with the help of a Doppler ultrasound, the method includes sound waves for imaging, wherein the blood flows in your vessels will be looked out. And ABI, this is accompanied by ultrasound and pressure cut around your ankle and arm, measured before and during exercise. This will help us to study the comparison blood pressure readings in the leg and the arm. Lower pressure in the leg can indicate a blockage and can also indicate a risk of PVD. MRA, which includes magnetic field imaging, where the images of the blood vessels can be taken, and in case any blockage will be identified with this MRA. CTA also uses X-ray. It is also takes the images of the blood vessels, and in case of any blockage, the same will be reflected on the reports. And angiography, wherein the dye is injected in a catheter that guides through the artery, and the flow of the dye will through the blood vessels can be used to diagnose the clogged artery. And these all are the various ways or the methods which will ensure the PVD is present or not, and will help the healthcare professional to diagnose PVD on a timely basis, so that further treatment can be designed for the safety of the patient. So how this PVD can be prevented without going to the hospital, or without including in the pharmacological methods. So firstly, the person can avoid smoking and can also control the blood sugar, because we discussed that diabetes is a risk factor for PVD. So limiting or controlling the blood sugar levels is also a way to minimize the risk of PVD. Exercise should be there for at least 30 minutes 5 times a week. The persons should also work to lower the cholesterol levels as well as the blood pressure, because higher levels of cholesterol can help the plaque formation, which ultimately turn into a blood clot. Ensuring a healthy diet with low saturated fat is also a way to prevent PVD. And lastly but not the least, keeping the weight at a healthy limit can also minimize the risk for obesity and the occurrence of PVD. So keeping a healthy diet and ensuring a safe exercise will limit the occurrence of PVD, or can prevent PVD. So to summarize, we can say that PVD is a blood circulation disorder that causes the blood vessels block or spasm. There are various risk factors including smoking, high cholesterol, blood pressure, diabetes. There are various diagnostic methods that can be performed by a healthcare professional to diagnose the PVD so that the further treatment can be processed. However, there are various ways this PVD can be prevented or self-managed, which includes exercise, healthy diet, and avoiding smoking. So these are the ways that which will support to prevent PVD. So this was all about PVD and how the self-management of PVD can prevent the risk of peripheral vascular disease. These are the references that were used. Thank you and have a nice day.